Hi, my name is Georgie Buxton and I am one of the modern matrons within Ridgeway Secure Inpatient Services.
My name is Emily Bengo. I'm a clinical lead at the Newtondale ward within Ridgeway Hospital.
My name's Eileen. I work in Ridgeway, Rosebery Park. I've been here for 10 years.
My name is Jade Jackson. I'm currently the ward manager of a medium secure autism specific ward within Ridgeway.
My name is Kohinoor Akhtar and I like to be called Asha. I work in Ridgeway in a forensic unit.
Hello, my name is Rosie Hales and I'm clinical lead.
My name is Stacey Rankin.
Within my current role as ward manager, I'm responsible for the following: the operational management of clinical services, ensuring excellent services are provided to our patients, operational management of all staff, to lead and develop services, being an integral part of the MDT to collectively plan, deliver and review plans of care, ensure patients' care plans are co-produced and individualised, being a role model to all staff patients and to act with integrity and professionalism. You may have heard people talk about the journey to change, and a large part of this is about co-creating safe and personalised care that improves the lives of people by involving them as equal partners.
I have worked within Ridgeway Secure Inpatient Services for 25 years and I have observed many changes over that time. One of the main changes is the drive towards collaboration and co-creation, ensuring patient and care reviews are represented as much as possible, recognising the importance of care and patient involvement on recovery and so on.
There's an awful lot of stigma that can be placed around working in secure services, but actually when you come through the doors, everyone's really friendly. You know, everyone speaks to each other, the patients, the staff, we all get involved together and with activities and lots of fun things going on. It's just a really nice place to work, and I really enjoy my days at work.
Being a student nursing associate bridges the gap between healthcare assistants and nurses. The role of the nursing associate supports the registered nurses, freeing them up to focus more to complex clinical work. Having patients live their best possible life is an important part of working in Ridgeway. Living our values is one way of achieving this. Treating patients in our care with respect, compassion and being responsible to patients is important. I enjoy doing activities with patients and engaging with them to find out what interests they have. Finding out what a patient likes to do for activities when they come into the hospital is relevant to their care.
We are a link to other professionals. We as a ward staff, we are also a link to other non-medical staff. For example, the mental health act office, the pharmacy, we've got safeguarding team. So we do support them in all ways.
If carers have got any questions about the relative's care, obviously we would have to gain consent from that patient first to be able to discuss that. And if that consent is obtained, then we'll be able to discuss things over the telephone with the patient's named nurse. We'd also encourage that you attend any relevant meetings such as CPA or recovery meetings and tribunals, things like that. And that'll give you a chance to speak to the rest of the MDT and the consultant psychiatrist.
For those patients who consent to their families being involved in their care, I actively encourage my team to maintain a contact agreement to ensure that we holistically support our patients, carers and families. This also entails that we work with the family to seek their views on risk assessment, safety management and involve them in all areas. Over the years, I have witnessed great quality care which has led to recovery for patients, and this was inclusive of families. Families and carers matter to us, as well as the patient. Families and carers are critical to our patient's journey and recovery too.
Ridgeway provides a sense of community and working together. We work hard to show our care and compassion for one another and work in the least restrictive way possible, always striving to do more and to improve as individuals, as professionals, as teams and as a wider service.
If carers are wanting to arrange a visit with their family members, they would just contact the ward directly via telephone and speak to a staff member. We'd be able to check the diary and see what availability we've got, and we can easily book that in. When carers are booking visits, they can expect to be met at reception by staff. Then they'll be taken to the most suitable room, so whether that's on the ward, we've got family visiting rooms on the wards, or we've got child visiting rooms, which is suitable if obviously people are bringing children in. We've also got an on-site cafe, so sometimes it's nice to have visits there, so we'll just determine that at the time. There is some items that are prohibited for visits, but that will all be discussed over the telephone. We've also got a list at reception just to prompt people about what you can and can't bring in. If you do bring things in, like such as mobile phones, you'll be able to keep those in lockers and they'll be stored securely until the end of your visit.
My favourite part about working in Ridgeway is being a part of people's journey, seeing people come into service really unwell but leaving at the other side, living their best lives, and knowing that you've been a part of that person's journey, or even just the small day-to-day things that can make a big difference.
Some people who come in here, they have a really traumatic event, so when they come in here, they get better, and I think that's the most amazing part of it. So seeing them, they're really good, they're doing their life is thriving again. So yeah, that's the part I like.
A lot of patients come through the doors who have had an awful lot of challenges and complex needs. And what's really rewarding is seeing the difference that I can make in their lives.
My favourite thing about my job is helping patients with activities and the day-to-day of their life to make sure that they are well cared for and safe and know that they enjoy their day as well. If they enjoy their day, that's made my day.